Welcome back to another episode of Analyze Scripts. We are super excited today to cover season 1 of the hit show Grey's Anatomy, which was released about 19 years ago, actually, on March 22nd, 2005. Can you believe that? I can't believe
No.
it's been so long.
Mm-mm. Did you watch it right away?
I did not watch it right away, but I watched it I think the summer after it came out. I remember I was actually home from my first year of college. I was supposed to start a summer job at Bath and Body Works. Big deal.
Iconic.
If you want to sponsor us and send us a free body wash, feel free. But then actually I am so clumsy. I tripped and got this ginormous splinter in my foot. But I don't mean a splinter. I mean a shard of wood, literally basically a wooden plank. It was probably 4 inches long. I'm not kidding. It got impaled in the very bottom of my foot. It was so painful. We couldn't take it out because it was literally a wooden plank. And I had to have foot surgery to get it removed. It was a whole ordeal. I was on crutches for a long time. So needless to say, I didn't make it to my first day at Bath and Body Works. And I was so bummed. And
Who knows what would have happened if you had?
I know my whole trajectory could have changed. I was so bummed. And then my mom, I remember, rented this for me. I'm pretty sure from Blockbuster. Because she knew I was thinking about going into medicine and she thought I would like it. And obviously I did.
Yeah.
I hailed it. And it totally, I remember I did apply to Dartmouth Medical School because of Meredith Grey. I wonder how many people did. I wonder if there was an uptick in their applications. I bet so. But that's the first time I watched it. What about you?
I didn't watch it until college. So
that makes sense because you were younger. You're younger.
Yeah. I think there was probably 10 seasons out by then. And I just watched it religiously for weeks until I finished it. And it was so good. I have gone back and watched probably the first couple seasons over and over again.
Yes, me too.
I'm so disconnected from the newer ones. I don't know if you are still watching them, but
I honestly was until 3 years ago, maybe 2 years ago. And my DVR still records it. I just never get to them. But I watched it all through medical school. I remember my friend and I, Stephanie Feldman, shout out if you're listening. She's a really fancy cardiac oncologist, I think, at Memorial Sloan Kettering now in New York City. She's just something really fancy. She's so smart. But I remember we were really still into Grey's in med school. And after match day, when you find out where you're going to residency, there's always big parties and stuff. We went to one and then we were tired and we came back to my apartment and watched Grey's Anatomy because I think it was a Thursday.
Yeah.
Really fond memory.
That's cute.
I also rewatched this right after having my first baby, during maternity leave. I don't know why I was up watching TV instead of sleeping. I think I was having trouble sleeping. I don't know, but I decided to rewatch it and I got through a lot. I always want to get to the part with Izzy and Denny and the heart.
Oh my gosh.
We're not going to
I got so triggered when Denny makes a really quick appearance early in, because then he doesn't come back, and that's not in I watched on. I'm now on season 3, even though we're only covering season 1. But he does come, I think, quickly for just a drop in, and then he appears, and then the trauma ensues. So we really are going to do our best to stick to season 1. And with that being said, there is so much content. We have so much to say. So we are not going to do any sort of recap. We're just going to kind of talk about the characters and then about residency. So
right. We're going to assume you know what we're talking about. We're going to assume you remember the huge surprise at the end when Addison shows up. By the way, I've always been trying to get her shade of red in my hair. It's so beautiful. And we're going to assume you know what we're talking about.
Yeah.
We did see some recent comments. Thank you for leaving them about our podcast wanting to have a little more structure and have us focus on analyzing the characters themselves. So we're going to do our best. And we hope that you enjoy. And again, every time we keep recording, with this, with beef, with everything, I always say we could do a second episode about every show we talk about easily. So if you keep supporting us, maybe we'll get there. Maybe we'll get to, Acast Plus. And I'm going to say we will get there. Not maybe. I'm going to say we will. It's a matter of time.
Yeah. We still just work full-time jobs. So we're doing our best here.
We're doing our very best. So anyway, I think it'd be interesting to say right off the bat, I noticed a ton of stuff they get wrong about being a surgical intern. Did you notice anything, or am I picking it up just because I've been through residency?
I think you probably are picking it up more. I mean, I think that I would imagine that things are maybe more like dramatic than they are. But what I would say, you have said in the past, and I would imagine being right, is just like the long, long, long hours and
Yes.
what being a resident can do to your mental health and physical health is like so
Yes.
draining.
So draining. And we know that physicians have really high rates of mental health issues, primarily depression, anxiety, substance use disorder, things like that. Um, we know that when you work a lot and you're not
Mhm.
sleeping, that's like not good for you. There's been data and studies out there that show that driving when you haven't slept in 24 hours is just as bad, if not worse, as drunk driving. And so by the time I started residency, they had enforced what they call work hour restriction. So back in the day, it was called residency because you basically lived in the hospital, and you never left, and you would follow your patients like from the moment they got to the hospital until discharge. It's very different now where you have teams and people cycle in and out. And now they have work hour restrictions. However, the restriction is you can't work more than an average of 80 hours over a 2-week period, which is still a lot. That's that's
So 80
still
hours a week for a
a week
2-week
on
period. Okay.
average.
Yeah.
So if you worked 150 hours one week, and I can't do the math off the top of my head, 70 hours the next week, that might average out. So it's not great. And I
No.
think, some programs like you'll work 150 hours, then you might have the next week off. So you have 0 hours. Do you see what I mean?
Yeah.
So you're
But like
still
that
working a lot.
150 hours week is like, I don't know, sounds a little unsafe to me.
Yeah, right. And who wants their doctor or their surgeon to be operating on them with no sleep?
Mhm.
So there's a lot that stands to be improved. And obviously, I didn't do a surgical residency, but as part of my intern year, we did 6 months between internal medicine and neurology rotations, including time in the ICU. So I got a nice taste of what it was like to, get to the hospital before the sun's up, leave long after the sun has set. And spoiler alert, it sucks. And the biggest thing I think they got wrong here is that these people wake up way too late. They are waking up at 5:30, the sun is out, they are like sauntering in, they're all dressed nicely, they don't have bags under their eyes, they're getting breakfast, like this is
Meredith's
not
hair
happening.
always looks
Amazing.
fantastic. Yeah.
Amazing. I know, I kept watching it like how does she blow dry her hair? This is so unrealistic. Obviously, it's a show, but there's no way Meredith was late for her first day of intern year. Like, no way. Like when she and McDreamy wake up naked, on the floor, the sun is clearly out. Like, there's no way. Surgical interns, I'm pretty sure, get there between like 4 and 5 in the morning. Like, that's when they arrive to do all their pre rounding, which means they
Mhm.
check on all the patients before the resident gets there, who then checks on the patients. And then you have rounds at like probably for surgery, 6 a.m., probably the rounds with the attending. Maybe 7 if it's a holiday or a weekend day, but you do it really early to check on the post-op and the
Mhm.
pre-op patients because then you need to get into surgery. And you're usually in surgery. The first one's usually around 7 a.m.
Right.
So you're doing a lot first thing. There's no way you're waking up at 5:30. There's just no way. I also felt like they had a lot of extracurricular things going on. Like they had the party,
Mm.
Izzy's baking, Derek's like taking Meredith out on dates. Like there's no time for this, unfortunately. Like you live, breathe, sleep at the hospital.
Yeah.
And then by the time you leave, you're so exhausted, you just sleep at your house. It really sucks. I hate to say.
Mhm.
So those are some huge, just like general intern year things I feel like they got wrong. I did think they got the hierarchy right. Like
Mhm.
intern reports to the resident who reports to the attending, and they did display how tricky it is to like move up the hierarchy, like we saw with George and McDreamy when he was concerned about the anesthesiologist smelling
Right.
like alcohol. I thought, interestingly, I felt like they got a lot of the complicated emotions of being an intern really right. And then some of the very basic concrete facts about intern year, like really wrong,
Mhm.
which I just think is really
Yeah.
interesting.
I did like how and this was, I think they did their best to bring in a level of accuracy with like having Izzy pose for those pictures to pay for medical school because
Mm.
like Meredith, has her mother's estate to a degree. She has that house. Christina Yang seems she comes from a
Beverly
decent amount of
Hills.
money. And then we have like George and Izzy and Karev who
Mhm.
seem like pretty normal people who like can't afford, the hundreds of thousands of dollars of medical school. And so, Izzy posed for pictures, and George, like they're living with Meredith, they're roommates. It's like that, even
Right.
though it's like lucky that they're in this wonderful house, it's like that gave, I think, just a little bit of the like,
Mm-hmm.
people are struggling wildly,
Oh
right?
my
You get
God,
like a small
100%.
stipend, like you're not,
Yeah.
you really can't afford to live in a home, in like in an amazing
No,
apartment if you're not already
no.
wealthy.
And when you factor in like the hourly wage of being a resident, it sucks. Like
Mm-hmm.
when you look at like the starting salary, it might be between like 60 to 70 grand, which is great, all, across the
Right.
board. But when you think about you're making that and working 80 to 150 hours a week, like the hourly rate's really low.
Mm-hmm.
Many people come out with multiple hundreds of thousands of dollars in debt. I call my medical student loans my second home. Maybe I should call it my first home.
Yeah.
Um, and before I went into residency, they had a law that when you were in residency, your student loans would not accrue interest. However, unfortunately, that changed when I got there.
Oh,
So your loans keep accruing interest, and that sucks. I think it added in like another 100 grand on top of mine. I'm not
wow.
lying. So it's tough. It's really tough. And that's just like the logistics, not even the stress and emotions that come from being a new doctor,
Mm.
which is like terrifying.
Yeah, no, totally.
And I felt like they really got that right. Like when that iconic first scene of them all walking into the OR and getting that tour is just so true. Like when you walk into the hospital and you think like, oh my God, like I'm the doctor now, and as the
Mm.
intern you are the most forward facing. Like you see the patients the most, you see them first most of the time. Of course your attending's always there to like supervise and back up, but you're
Right.
really like in the trenches. Like you're often the first one who's at the code. I thought like that depiction of all of them going to the code blues, it brought me back to going to my code blues and being so scared I was going to be the first one
Mm-hmm.
there. And then when you are, you're like, oh no.
Right, right.
It's really intense. Even like I remember the first order I wrote for medication as an intern was for Colace, which is not a big deal, but I like was so scared I was gonna like it was gonna interact with
Right.
another medicine someone was on, and I did like so much research about Colace, and it's just like Colace, which is like a
Mm-hmm.
laxative.
Right.
But it's just yeah, it's heavy stuff. I thought like this show does really get right just the emotions of being the doctor, and I think witnessing the highs and lows of life and
Mm-hmm.
death and mortality and what it's like to call time of death for the first time, or decide when you've done enough CPR or not do CPR when you want to because the person has a do not
Right.
resuscitate order. Like all of that stuff I thought they got really accurate.
Do
But I
you
will
think that
say
there's a lot of moral, like, do you think you kind of are faced with that, depending, of course, like in what rotation you're in, with that kind of during your intern year? Like that's when
oh yeah,
tag your first body. That's when you say time of death. That's when you have to tell
yeah,
a family for the first time. Like it seems like there's so many such intense, like emotional
yes,
parts of being an intern,
yes.
barring obviously all then the anxiety and the technical stuff and the stuff that you need to know. But it just seems so heavy. And then with that, like you're not sleeping well, you're like,
Right, you're not
you're just
eating, you're not
anxious all the time. I would
100%.
imagine.
Oh, 100%. Yes, I totally think so, and I feel like watching this show at this stage of my life now, I really was, like, brought back to so many formative experiences, even when I was a medical student. Like, I
Mm,
thought a lot about my first rotation in my clinical years of med school was trauma surgery. Just, like, start off with a bang, and it was, like, really intense. A, the hours, B, I had no idea what I was doing. Different I don't think medicine is like it's like a pretty abusive environment, I will
yeah.
say. I think there is a lot of machismo. There is a lot of like, well, we had to do this, so you have to do it. A lot of like
Yeah.
what we might call identifying with the abuser, identifying with the aggressor, like my life sucks, so yours is going to suck.
Mhm.
But I even remember as a medical student on trauma surgery, our very first day, they expect us to pre-round. None of us know what that means. We don't know what we're supposed to ask patients. We don't know what we're supposed to examine. We have no idea. And they don't tell us. And then they do pre-rounds with us and they like literally laugh at us. And then as we're walking from patient room to patient room, I remember the attending saying something like really mean, just like, oh, these stupid medical students, blah, blah, blah. Like they're like, people are just mean. And they don't really like help you out. Not everyone, but like that is true. Um, And so there's some of that, like some hazing culture and things like that. I
Yeah.
think, of course, like different programs are different. I think, the culture in general, I hope, is improving over time. Different fields are different. Like psychiatry is very much, at least in my experience, has not been like that.
Mhm.
But there are
Surgery
more,
feels different. And
it's
I was going to
it's this
ask you,
macho
like,
culture.
yeah, even thinking of the residents like Meredith Gregg, she has all that pressure of her mom being this like rock star surgeon that has, these certain techniques named after her. We see Christina Yang seems to be really like,
She was
um,
such a good portrayal of a surgery resident. She's
yes,
perfect.
thanks for
What we
saying that
call,
very
yeah,
clearly.
we
Hmm.
call that a gunner. That's what we call it in med school speak, is like you are just gunning for what you want at all costs. Like that's
Hmm.
her. Really fascinating that she gets unexpectedly pregnant, and how she deals with that. But again, I felt like this season one tackled like so many big major issues in like
Yeah.
a really interesting, thoughtful, provocative, intelligent way. But yeah, Yang is like the classic stereotypical surgeon.
Hmm.
And I love that she was a female, because I just think like you expect that to be the man, right? And so it's just really cool. And then Izzy, I feel like, is like the non-surgeon surgeon. Like I always identified more with her, in terms of how she gets emotionally connected to her patients, and like too far. She
Yeah.
struggles with boundaries. And I think like, do you think that's connected to her upbringing and her lack of a maternal figure and things like that? I mean, we could like really dive deep just analyzing these characters by themselves.
Right. I mean, I think that Izzy seems I think to a non-regular surgery folk, like the most relatable. Like,
Yeah.
I would expect for people their intern year in surgery, or I guess in general with being a medical student, to like really struggle with the patient side of it. But I feel like then,
Yeah.
but that's we don't see that. Like Christina has to learn to have bedside manner. She has to learn
Yes.
to like
Have
be
empathy.
empathy and
Right.
like understand what they're going through, and it not just being this task. And I understand
Right.
also, though, she needs to come down a little bit with empathy, but
Right.
Izzy needs to come up with boundaries. And so she
Yes.
doesn't get crushed, and there's
Right.
not incidents that we see later on
And later
where it's
on.
so you see it coming from a mile away, like over identifying with the patients,
Mm-hmm.
getting too invested, getting too involved. And
Mm-hmm.
it's dangerous. And we see it become dangerous. And we see, little whispers of that in season one with her.
Yeah.
Um, I think she also feels on the outs. I think she feels different from Meredith and Christina. They're like, they've bonded. They're like the two besties now. They're each other's person. And she's like the other female who I think
Mm-hmm.
feels
Mm-hmm.
really isolated, not only because she's not a three is kind of always a crowd,
Right.
unfortunately, but
Right.
also because I think she is a little bit different in how she went to medical school, her
Yeah.
socioeconomic status, they
And
all
her
seem to have
looks.
family issues, but
But also like just her looks, like
yes.
she's going to be ogled and things like that
Hmm.
differently. And it was an interesting storyline that she had to like do that to even afford medical
Right.
school. And now she's trying to sort of shed that image. I loved when like her old boyfriend came and she was like,
Hmm.
I'm not doing this anymore.
Like
Um,
this is my life.
Right. And
Hmm.
I think exactly. And those are the things I think the show gets so right, is that is so hard learning how, at least for me, I definitely like I never cut someone's LVAD wire or did anything egregious, but I definitely have had to learn how to have emotional boundaries in my work, because I had a very good friend who always said to me my intern year, like, Katrina, you have a bleeding heart and it's like
Hmm.
so great. You can really connect with people, and especially, not to like toot my own horn, I'm not trying to do that, but in other ways that's also really challenging,
Hmm.
and like a quick road to burnout, and you don't want that part to get in the way of your clinical decision making either,
Right.
because you have to keep your wits about you and stay objective enough to be able to recommend the right treatment, even if it's not what they want to hear or things like that, or the family wants to hear. Like, this is all like so hard.
Right.
So I think you're totally right, Portia. Great depiction of how one person is going to come in on this side of the empathy spectrum, who needs to, not lose it, but rein it in a little bit, have some
Hmm.
better boundaries. And then on the other side, you have Christina, who needs to learn some of those skills. And that
Yeah.
happens. And that doesn't mean Christina's like an awful, terrible person. That's just not her strength. And in a
Right.
lot of ways, I think that makes her a good surgeon. And I think
Mhm.
like I would love to do a study. I never will, but to see like what sorts of people, what personality types end up in different fields of medicine. Um, because I think there's a lot of like, that defense mechanism of like sublimation in
Yep.
surgery. And, it is like really gory to cut people open. I think
I would imagine.
I think like a lot of people like don't want to do that. I
Mhm.
remember in my training, maybe it was med school, I can't remember, like when we were learning about the different psychological defense mechanisms, and my teacher was like, yeah, you could be a serial killer, but like you're not. Instead, you go into
Yeah.
surgery. So you satisfy that
Mhm.
need of like, looking into someone's body or cutting
Yep.
people or, cutting flesh, like stuff like that in like a socially acceptable way.
Mhm. No, totally. And I think it was funny them, kind of already their intern year, kind of naming like the certain types of residents. So like when they're having the party, Christina saying like, we want the jocks only. We don't want
Yes.
psych or peds.
I know.
And I
Yeah.
was like, oh, I feel like the psych residents could probably party more,
I
in
know.
a little, maybe an interesting way, being
Yeah.
silly. But like, I just think it's funny how you group in, right, with like
Yes,
like-minded
like
people.
like orthos are total jocks.
Mhm.
And yeah, 100%. There's all these stereotypes. And sometimes there's some like kernel of truth within them. Other times not, right? Like I think a lot of people think of surgeons as more cold, more removed. And I think like again, in some ways it's not like you have to be, but in some ways you have to be because
Mhm.
people are dying on your table way more often, knock on wood, than like in my office
Right,
every day, right? Like just by the
right.
nature of the work, you have to want to like cut people open or
Mhm.
like put in central lines or put in chest tubes or all these things that like when I was doing my Mickey rotation, I like never wanted to do that stuff. So I would just let the other interns do it. And that's why I'm a psychiatrist.
Yeah. No, that makes
Um,
sense.
Interestingly, I did hear at some point along the way that a lot of people do transfer out of surgery. And they're most likely to transfer into psychiatry, which I think is really interesting. And I had Dr. Q, actually, our friend and my mentor who joins us for our Harry Potter episodes. We were talking about it once, and she was like, well, like surgery can be very invasive on your body, but psychiatry is very invasive
Hmm.
psychologically and mentally. And so it's kind of like you're still like exploring and wanting to go deeper just in a different way. And I thought that was a really
Yeah.
interesting assessment.
Yeah, no, I like that. She's so great. If you haven't
Oh,
listened to check out our Harry Potter episodes,
and
but
she'll join us again soon for the
Mhm.
third one.
So
Um,
what about, George?
oh,
What
I
are your
love
thoughts on
George.
George?
I love him. Again, he's like on the like he's on the I like group him on the Izzy side as more like mild mannered, humble, um, nervous. I
Mhm.
feel like he's like the underdog. Like he's really smart. I think he's really capable, but he gets nervous under pressure. And when the attendings and other people are like ragging on him and hazing
Yeah.
him, and then again we call it pimping. When you like are asked a question on the spot that like you're supposed to just know, they always would do this in training. They'd ask you some random thing like, what's the third step of a Whipple or something? And you're like, I don't know. And I don't know why they do that. It's meant to, I don't know what the goal is. It
Mhm.
just makes everyone feel bad. But I feel
Mhm.
like he is more likely to like feel hurt by that than like Christina, who
Yeah.
probably knows, you
And there
know?
was a lot of themes about him and his, like, masculinity on the show, right?
Yes.
It's like he was really, characterized by, Alex and then by, potentially Meredith and Christina as like, "Oh, he's, like, gay and, he's this
Hmm.
friend and he's" they don't have to worry about George, and I think
Right.
he's really, really, really offended by the friend
Yeah.
zoning and just, like, the
Yes.
demasculinization when they all live together, right? They're all coming in, he's, like, naked in the shower, and he's like, "You can't do this. Like, what are
Right.
you
Right.
doing?" I
Right.
also
And
think
they
it
want him to
just
buy
speaks to
tampons.
exactly, him growing up, like, I think, he has all brothers, and I think it's just, like, a girl is like a girl, and, like, he didn't do that, like,
Right.
that's wild, and, maybe if he had a
Right.
sister, like, it wouldn't be weird to buy, tampons or
But
pads
he's
for
also
close
like
friends.
attracted to Meredith.
Exactly.
And I feel like probably every man at some degree is
Mhm.
attracted to Izzy. So I
Mhm.
think it's like maybe he doesn't want them to see his,
Right.
private areas and stuff. Yeah, it was really interesting, the George Alex,
Mm.
dichotomy. And especially when we see Alex's arc over like the next 10 seasons,
Right.
I forgot how much of a jerk Alex was.
Yeah.
But then
It
it's
almost
like,
seems like he's not even a main character in the first
I
season,
know.
you know what I mean? Like, he's just
Right.
comes in and out and is just, like, an a-hole.
But it's interesting because he's such an asshole and overly cocky and arrogant, but doesn't have the skill set to back it up. Like, he's
Mhm.
like not a good doctor, at least in
Right.
season 1. He's like way over arrogant, way cocky. I feel like he would be put on like a performance improvement
Mhm.
plan or like monitored really closely, because he's like not following up on patients,
Right.
missing labs, people are getting sick, like
And
under
rude to
his watch.
nurses,
Rude.
like
Yeah, so rude, misogynistic. Like, I did not like him. And then we have George, who probably like does know his stuff. He is a good team player.
Mhm.
He is respectful. And then he has the bravery and the gall to say to McDreamy, like, I think this attending's drinking.
Yeah.
Like, that takes a lot of guts.
He has a pretty
Um,
strong moral compass, I'd say,
yeah,
like
exactly.
mhm.
So again, those are interesting characters
And it
too.
seems like why they also really, really don't like each other, or they really have these, like, wildly, kind of, like I don't wanna say aggressive, but, like, they have, like, all these bad interactions, and I feel like it's almost coming from a place of jealousy of each. Like, George is jealous of Alex's, like, confidence and his, like, the way he just, like, is with women.
Right, right.
And then I think Alex, and I don't think he would ever admit this, season
No,
1,
I
of
think this is all
course, but,
unconscious.
like, I think he sees George as really intelligent and also, like,
Mhm.
in with the ladies in a way
In a
that's
different
like
way.
yeah, in a way that's like friends and real and authentic and like intimate, which I think
Mhm.
it really never is. It's always surface. Like he's just like
Right,
having
with
sex with a lot
Alex.
of nurses here and there and
Yeah.
it's nothing's really deep. I think based on what we learn later, I think that's all he can give. Like I think it's unsafe for him to be more,
Yeah.
deep with people, but I think that's kind of his way of defending himself. He has to come across as like this know-it-all jerk so that he doesn't get hurt.
100%. I mean, I feel like we're seeing little whiffs of that avoidant
Mhm.
attachment style, like, right off the bat.
Mhm.
And then we're also seeing, like, Meredith's, like, anxious avoidant attachment style, right?
Yes.
With McDreamy, where, like, she wants to be close, but she's scared. And then who is it that she ends up being close to? This, like, kind of parental figure,
Yes.
who is kind of dangerous,
Mhm.
right? And so, like, again, trying to stick to season 1 and not getting into the weeds about all we know about Thatcher, which
Yeah.
comes out way later, but it makes so much sense, right?
Mhm.
And I think even like what we know about her and what she's going through with her mother, it also makes a lot of sense. And I will say this depiction of Alzheimer's disease, way better and more accurate than in the Notebook, which we
Yeah.
totally annihilated a couple, last month when we reviewed it for Valentine's Day.
Mhm. It was
Um,
hard to watch scenes with
I
her and her
totally agree. I
mom.
know. I was watching this and I was like, what am I doing to myself with this podcast? This is like exposure therapy for
Mhm.
me. Like, I don't appreciate this.
Mhm.
It is hard to watch, but I feel like it's a lot more accurate.
Yeah.
But I also think it must be hard for Meredith in some ways to like go back to the hospital her mom was such a like queen at.
Right.
Like, that's a lot of pressure to just step into. And all these people will have these preconceived notions about her that might or might not be true. And we really saw her grappling with that, especially with her mother and feeling like
Mhm.
she had to keep it a secret that her mom's not really traveling.
Right.
And then she just really like breaks down about it.
And
And then
Izzy
it made me,
really, like, throws that in her face, with, like, when she kind of loses it with the pictures, that she goes on to, talk about, like, and, when you walk into a room, everyone assumes you're the doctor. When I walk into the room, everyone assumes that I'm the nurse, which, like, I think within power dynamics, like, she's a very attractive woman. I think, if we're speaking really, really stereotypically in um, generally like you've even talked about this, like a man coming in and they're the
100%
doctor versus like no,
all
they're
the
the nurse
time.
and you're the doctor, like that
Oh,
does
100
happen.
times.
And
Yeah.
with
Or,
Izzy's sexualized body too, it's like
right.
that's I think she feels very um lower in what people think of her compared to Meredith.
100%. Yeah, and that's well known, that, and something I've experienced a bazillion times, like as a resident or even the attending doctor when you're trying to talk to the patient, and then like the medical student walks in and they're like, "Oh, let me talk to him. What does
Mhm.
he think?" And you're just like, And I think for, unfortunately, people of color, that's even
Mhm.
worse.
Mhm.
I think a lot of women get assumed to be the nurse. And I think, unfortunately, at least what I've heard from my colleagues about, people of color are assumed to be positions that might be perceived as even like lower.
Mhm.
And again, not to get into like, this position's higher than this one is lower, or things like that. But it's just interesting how people make so many assumptions before they even get to know you
Right.
just by walking in the room. And we see that with Meredith and Izzy, like you're talking about. And again, it's like, I also see where Izzy's coming from. Look what she
Mhm.
had to do to get there. And
Right.
she's assuming Meredith has like really had it handed to her. And
Mhm.
Meredith might have had a lot of privilege and doors opened along the way just because of her name. But then we see all this other struggle going on in
Yeah.
the background, which leads us to the big relationship of Meredith and Derek.
Yeah. Oh,
Tell
it's
me your thoughts.
so I think, it's so inappropriate based on what we know. Like, she is absolutely parentifying him. I think, yeah, of course, it starts off like he's a hot guy, she's a hot girl, like they're at a bar,
Meet
they
at the
talk, they
bar.
hook up. Like, yes, would that wildly suck if that like that could absolutely happen. But like it's like what happens after they're both kind of acknowledging why it can't work, why it's inappropriate, and also why it's just like we know that Derek is also still married. Maybe like separating it would be fine, but like that's not what happens initially. So
Mm-hmm.
it just keeps on going on and she goes back and forth, right? She's really torn. They have all these like elevator moments and it feels also like really dramatic. And I know it's a show, but I think it's like it's also purposely dramatic, which just makes
Mm-hmm.
me feel that like anxious avoidant attachment style where it's like I
Yes.
get really close and I go away. I get really close and I go away. Like I'm scared,
Mm-hmm.
but I also know that this isn't good for me, but then I'm
Right.
choosing it like back and forth.
Right.
It's I just, I
And
feel
also, like,
sorry for her.
I do too. I feel like he's using her,
Mhm.
at least manipulating her, preying on her vulnerability. Like,
Yep.
she tried to say no at the beginning so many times,
Mhm.
to point out that, like, this is gonna be a lot worse for her than for
Right.
him because she's the new intern and he's, like, this bigwig neurosurgeon, and he just keeps chasing her.
Right.
So when you look at it like that, it's like harassment. And if he's already a practicing neurosurgeon, it sounds like he's been doing it for a couple years at that point. He is way older than her because surgery residency is 7 years. I believe neurosurgery fellowship is another 7 years. Sounds like he's been practicing for a while to make such a good name for himself. He's like at least 15 years likely older than her.
Mhm.
If she went straight through college and med school, which she probably did. So there's like an age dynamic, a gender dynamic, a power dynamic, and he's
And
totally
he's
taking
married,
advantage
right?
of it.
Like, and it's
He's
like, it's
married
not like he disclosed that. So that would be
at
different if I'm like,
all.
I'm separated, like, we're in the process of divorce, like, which they weren't. But I just mean like he intentionally kept that from her, which to me
Yes.
is a wildly terrible red flag. And then
Yes.
you're right. Like she really does try to throw up a boundary over and over again. And then
Over and
he,
over.
and it's just again, it's some of it's like cheesy, McDreamy, but like, you just will look
He
at her,
is he is
Meredith, but
dreamy.
like
He
it's
is
also
dreamy.
like manipulative. Like
Yes, Mick
he's
manipulative, Mick
mhm.
nasty, Mick red flag, like Mick narcissist. Like, I don't know. Like,
And
I
I think it's that bias that we have and we all have it with, he's also like attractive. And I think
Mhm.
attractive people get a pass. I think if he like wasn't at all, it would be like, oh, he's creepy, he's gross. But it's like he's
Yeah.
McDreamy. Like, yes, of course there's that position of power too, which is like I think separate. But then there's the fact that he is very, 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 attractive worldwide. He's been named right like Patrick Dempsey has been named like
Sexiest man
sexiest man
alive,
alive
like
so
a
many
billion
times. So
times.
I think that's also why it's just like, oh, it's okay, but like it's really
It's
not.
not.
And
Right,
then
and
I don't know.
mm,
I don't know.
what were you gonna say?
And then Christina like
I
does the
know.
same thing, and then she doesn't tell Meredith. Like everyone's like judging Meredith for it, but then like Christina is also in this situationship at first, in season
Mhm.
1 with Dr. Burke, which is like
Right.
another attending who's
Right,
way
and again,
older.
I'm not gonna pretend like this doesn't happen. It does. It's just really frowned on, and I
Right.
think for, like, good reason,
Yes.
um, because it is, like, that power dynamic is just so big,
It's
and
also
it
like student teacher,
that's
it's
what I
not
mean.
just like, oh, it's your boss, which like that happens too. And like, again, if people are honest and open, and it's not icky. Like that can be fine and
Right, like, I'm
fabulous.
thinking about from the morning show, like, Yanko and Claire, right? Like, to me, that didn't have the ick factor that
Right.
this does.
Right.
Because 'cause you're right, they are their teacher, their boss, like, they are gonna be, like, with them so intimately
Mhm.
and all these decisions and
Favoritism, or then isolating
favoritism.
them if they don't do,
Right,
if they
helping them
break
get
up.
into fellowship or not, and, like and again, it's like, even if it's not there, it is there, I think, in situations like this, like, well, what happens when I wanna stop? Will I stop getting surgeries? Will I be shunned? Will I be
Right.
banned? Will they then, tell my chair? And it's really tricky, and also, like, Richard found out about McDreamy and Meredith. It does nothing?
Right.
What?
And it's,
You know?
like, it's just, I don't know. And well, I know I'm going into a little bit after season 1, but, like, from what we know about Richard, with, like, him being close with Ellis, to say the least,
Yeah,
like,
uh-huh.
I feel like he should be more protective than he is
Protective.
about Meredith, and, like, he's
Right,
not in, like, a really big way, which is also not like a it's not hard to be like, "This is an inappropriate relation, you need to stop." Like,
right.
it's kind of simple, and then I don't know. I think it's interesting though how both Christina and Meredith, and what that says about them in ways that they are similar, in ways that they are different, to both be with attendings. I feel like
Mhm.
for Yang, it seemed initially really just like scratching an
Sex.
itch. Like
Right,
she's
no,
just
it
having
does.
sex and she
And
can keep it that way.
I think Burke is getting, like, emotionally attached to
Right.
her, and she's just like, "We're just boning,"
Right.
you know? And then whereas with Meredith, it's very emotional.
Mhm. Yeah. And Meredith is very emotional. I think she has that. She gets really impacted by that patient who was assaulted, sexually assaulted, attacked. She bit
Mhm.
his penis off. They find it in
Mhm.
surgery, and
Mhm.
she has the same shoes as Meredith. And that, again, I feel like it's
Yeah.
one of those things that I'm sure, of course, patients stick with us at any
Oh,
point in our career,
100%.
but, like, that's one of those things that I feel like there's all these firsts that, if you're seeing a lot of
Mhm.
people, or on a lot of cases, like, you are exposed to a lot of trauma, and just
Yes.
having that of, like, "Oh, she had the same shoes as me," like, feeling really aligned, like, similar, and then I mean, it's terrible to work with someone therapeutically who's been, assaulted, attacked, but I think we, like Dr. Q says, we are on the inside of the brain, but also then to see a
Yeah.
body that's, like, been abused,
Yeah, it's
attacked,
really
I feel like
hard.
is different than just cutting someone open and taking their appendix out. Like, that
It
feels
is.
worse.
It is, and I feel like what's coming to my mind and who I've thought about so much in rewatching this show is, like, the first time as a medical student when I saw someone arrive in the hospital, my trauma surgery rotation, DOA, or dead on
Mhm.
arrival, and I was just like, I still could, like, cry thinking about it. Like, I remember that. I remember the first patient I really, really cared about and knew really well, and I loved their family in the ICU. When he died, all of a sudden, a code, and I had to call the wife and tell her he was dying. Like, you don't forget these things, and
Mhm.
I think, like, for me, like, it was so hard to bear witness to, and it also was really hard that it felt like I was the only one, like, really emotional about it, and the rest of the team just, like, goes on, and we don't
Right.
talk about it. There's not a lot of debriefing, you just go on. Like, I remember that, the patient who arrived, excuse me, who'd been hit by a car, when I was the medical student, like, the trauma surgeon walks in very nonchalantly, does what they're supposed to do to pronounce the death, and moves on, and I was just like, "What?
Yeah.
What? We're not gonna do more? Like, what?" And then on sidebar, like, the police outside or security was, like, restraining her boyfriend who was trying to
Mhm.
get to her, and it was like, and then we just move on to the next case, and I
Right.
was like, "What? I've never seen that happen before. Like, what's going on?" And I think, like, it's just it's so hard. It is
Mhm.
traumatizing. These things do stick with you. I think you really grapple with, like, mortality and the fact that, like, you can go to school forever and never, never, and learn all the things you can about how to save someone's life, and they still die.
Right.
And this season of the show, I thought, really captured that. Like you're saying, with that part about Meredith, like, recognizing that similarity with the shoes, or Izzy tending to the undocumented immigrants
Mhm.
in the parking lot. Like, all of those things, like, these things happen.
Yeah.
And I felt like they really captured that emotion. and like the journey that you move through it and how it's so different as an intern versus the attending, where you've done it now a million times and you might have this like wall up to protect yourselves because you can't fall into a puddle of tears like I did, as a medical student. Like you have to go take care of the next person. You have to give the bad news to the next person. And it's just like, whew. No wonder there's such high rates of mental health issues in healthcare workers.
I mean, you've got to compartmentalize, like, so in order to do what you do, like it's like a must. And we see Derek, like, and I'm curious just about Meredith's influence on Derek, because Meredith like talked to Derek about that patient and like he was carrying around the penis and was like really impacted by that story and wanting to do more. And then that man, right, like kind of drives to the front, like he falls over because he's like bleeding out, and they realize that it's because his penis is bitten off and it's bleeding. And Derek, goes in the room and like hits the bed or whatever he does. He has this big reaction, and it's like it's also interesting and again inappropriate just with that power balance of like how much is she influencing him of being like, no, this isn't okay, but because he's typically very like he's done this a million times, like he's grappled with things, but is it because he has a million sisters and this is a specific trigger as him of him? Like, why is he even on the case? It's like if he's neuro, and it's like it's just that it's interesting.
That's the other thing Grey's always gets wrong, is that these surgical residents and surgeons are in like every single case, right? Like they're always called down to the ER. They're going to the helipad. Burke's doing a Whipple. No, he's not. He's a cardiothoracic surgeon. He's not going to do the Whipple. Like Derek is not doing this thing with the penis, Derek, like down the road, does the clinical trial about Alzheimer's disease. Like a neurosurgeon's not going to do that. They focus on brain tumors and things like that. So yeah, that's like a clear thing that they tend to get wrong. But you're right. And I think like in some ways, I have heard so many times that doctors who stay in academics where they're part of like a training program, there's residents, interns around. One thing they often like is that it does keep them like in check in a way, like if it is an open environment where a resident like Meredith could talk about that openly, it probably keeps that thread of humanity alive, compared to like really just having to compartmentalize and shove that away to do your job. But I think it's really tough. And unfortunately, the hope would be that then they have support outside of work to process the trauma they're witnessing and that they're going through. So it's like you can compartmentalize it to do your job, but not compartmentalize it so much that it turns into PTSD, or that it turns into this sort of like festering psychological wounds that never gets addressed, that makes it hard for you to maybe connect to people in your personal life. And unfortunately, we know that like doctors have really high rates of mental health issues. I was just looking at a study we can link to in our show notes, called New Onset Depression Among Surgical Interns by Tasha Hughes and her colleagues, that was published in JAMA Surgery Journal in 2022, where they found really high rates of new onset depression in interns, especially surgical interns, especially female non-heterosexual surgical interns who maybe, if you had higher work hours, your rates were higher. If you had early childhood adverse events, your rates are higher. If you don't have a partner, higher baseline neuroticism, meaning you run on the more anxious side. All of that stuff, which is like, duh. But the rates are like really high. Like 30% of over 30% of new interns who didn't have depression before starting their surgical intern year developed depression. Whereas when you look at the rates of new onset depression in the same age group in non-doctors, it's only 5 to 10%. So that's 3 times as high. That's
and it's
huge.
so then clear, like in a product of the environment, you know what I mean? It's like, that's the only thing that's different.
And with a study even like this, like I'm sure a lot of interns like also weren't totally honest, because it's not the kind of thing that you want to be honest about, unfortunately.
Yeah. I mean, I think what we covered this in the movie Awake last year, and we had a guest, Dr. Gonzalez
Antonio,
who was an anesthesiologist, or is an anesthesiologist. And I think it was interesting because they do specifically have higher rates of substance use disorders. And I thought it was interesting how Grey's depicted like the anesthesiologist having, and so apparently accurate. Everyone knowing, and like that being kind of fine. Which they do have programs in all states, I think, for
And
referring a
paraprofessionals.
colleague, and they have like very specific things, because I think if it was just kind of a one and you're done, like there might not be a lot of doctors
That's the thing,
available.
right. It's like in
So,
society's best interest to support the recovery
right.
of professionals, whether it's
Mhm.
medical professionals, lawyers, teachers, social workers, and licensed professionals, again, whether it's teachers, lawyers, doctors, what have you, anyone who has like a professional license, rates of substance use are actually significantly higher in that crop of people compared to the general
Mm.
population, which most people would think the opposite, I think,
Yeah.
just because of bias and other things. But it's actually way higher. And the recovery rates, at least in the time in which they're enrolled in these professional programs, are pretty good because they're monitored so closely and so much more closely than the average person who maybe is
Mhm.
trying to get clean on their own.
Right.
There's a big incentive, in order to keep their job, they have to,
Yep.
avoid substances in order to maintain their license. And there's also a big incentive for society to invest that time in these professionals to keep them clean and still practicing.
Mhm.
And then unfortunately, like after those, it's usually 5 years, I believe, of monitoring, the rates of relapse are higher after that point
Mm.
once the monitoring stops.
Yeah.
But you're right. And unfortunately, I still think we don't talk enough about mental health issues in medicine, in trainees and providers. I would imagine the rates are even higher now coming out of COVID. And I really enjoy treating fellow medical professionals,
Mm.
like in my private practice, and just like normalizing a lot of this for
Yeah.
them, that like what you're witnessing is really
Mhm.
traumatic. It's not normal to pronounce people's dead.
Right.
And by the way, we don't say out loud "time of death 10:05." We don't do that. That's not done.
Mm.
It is in the movies, but not for real. But like
Yeah.
all that stuff isn't normal. Um, Reminds me of my friend, our friend Jessie Gold, who does a lot of good work, in this field, because there's still so much stigma. There's still so much fear that you'll lose your license if you seek out help and support.
Mhm.
I think that also varies state by state, and we all need support. And again,
Yeah.
it's like when you're working 150 hours a week, how are you supposed to go to therapy? Like, how are you supposed to make time for that?
I know. I mean, it's, you know, I'm wondering, whether it's just because she's an amazing rock star, or how she hacked the system. And people do come out okay from medical school and residency, but like Miranda Bailey is
Oh,
incredible. She appears to have such amazing boundaries. She
at
does,
first,
well, yeah. We do see her like struggle with, patients who she's had for a long time, or patients from when she was an intern or earlier on in residency, that I think those are the ones that still kind of trigger her. But
and
she
then she
is,
develops OCD, which again is fascinating and
mhm,
I think super accurate. That again, she probably falls in, if we're thinking about that study, someone with high
yeah,
neuroticism, female, working a lot of hours. We don't know about her early childhood. We don't know about her sexual orientation, like at this juncture, but she's at high risk.
mhm,
And again, I have seen a lot of new onset OCD in medical professionals. And again, in
yeah,
some ways, it's like I would imagine there's like a higher degree of OCD in that field because you have to check things over and over to
mhm,
make sure your patients are okay. So it kind of breeds that,
yeah,
just like COVID kind of bred some OCD amongst everyone,
mhm,
but it wasn't considered a disorder because it was
right.
like culturally normalized. Sorry, I cut you off though, but I agree. I love Miranda Bailey.
Yeah, she's just so great. I mean, I love how she feels like there's a little bit, I'm sure, if we're being like really cutthroat here with like, she like a little harsh or like mean, but I think she's not cruel. Like she's very
Yeah.
like, these are my expectations. Like this is what it
Mm.
is. Like, and I think it's again like she did it, that it was done to her this way. She's doing it to them this way. But like it does in season one, it's not. It She's very appropriate with Christina, keeping things
Mhm.
private.
Mhm.
She's very appropriate with just like giving direction, and yeah, she like gets them out of trouble when they're like giving that person an autopsy who they didn't
Oh
want
my
an
God, they would
autopsy
totally
done.
just be fired, and
Yeah, like
rightfully so. Like,
yeah.
first of all, they would not know how to do an autopsy, and second of all, like that's so awful and illegal and wrong. When like I don't
Mhm.
think you would just have them sign the consent after the
Right.
fact. Oh,
Yeah, but I think Grey's does a really good way of a really good job of really kind of continuing, right, all the main character stories, but then the patient stories are so
are
compelling, and I
fascinating.
think it's so interesting how we get so much detail and information in like a story from just like one episode, but also like there's always multiple patients per episode. I'm thinking of the teen girl who went to Mexico to get that elective gastric, I think, bypass surgery.
And like her relationship with her mom and like
that was such a good story that, and sad, obviously tragic and unsettling, but like, the woman with the tumor, like it's just all of these things. I don't know. I hated Karev so much when, so the woman comes in with the tumor. It's like massive. We learn that she has a lot of avoidance, which we understand after she kind of shares why. Sadly, she does end up dying, but she's in the ultrasound or something, and she hears Karev like saying terrible things about her after he was like really nice.
So nice. Yes.
And what distrust that creates again when she already had it. Like terrible.
Right. I know. Well, we do have to wrap up this episode, but gosh, we could keep talking for days about season 1 and about all the supporting characters. I agree. Like each one is so well developed and interesting and fascinating and acted so well. Even Katie Bryce, like Meredith's very first patient, I remember comes back like, a decade later in the show. So we hope you enjoyed this episode. Let us know if we should cover more Grey's Anatomy, if you want to hear more. And don't forget to follow us on Instagram and TikTok at Analyze Scripts Podcast. You can watch this episode on YouTube if you'd like. And please subscribe, rate, review, and share with your friends. And we will see you next time.
Bye.
Bye.